To err is human, to forgive is divine, right? So this idea, and very often people think that means we have this mandate to forgive. That's not
Mhm.
actually what the original phrase was meant. It's in a longer essay. And the point of it
Mhm.
is forgiveness is divine. God forgives. And it's hard, even in the literature, for God to forgive. Sometimes God gets real angry, depending on which tradition you're from. Forgiveness is a godlike thing. So we could strive to be kind, which is really what it means.
Hi, everyone. Welcome to the next episode of How Are You Really? Traumatized and Expected to Forgive. I am your host, Dr. Faryal Mallick. I'm a child, adolescent, and adult forensic psychiatrist. And today I am very pleased to invite our guest and welcome her, Dr. Travia. She is a licensed psychologist, EMDR certified practitioner, consultant, and CEO provider of courses on advanced topics in the treatment of trauma, including integrating ACTA and EMDR techniques and helping clients rebuild their sense of self separate from their traumatic history. She has been treating complex trauma for over 15 years in various settings with a focus on driven, gifted individuals. Her recent focus has been on the topic of forgiveness and how it is over mislabeled, misused, and weaponized by others to force victims to ignore their valid emotions and disengage from healthy limit setting. Dr. Travia is active in Florida Psychological Association and in American Mensa. She is finishing a manuscript on forgiveness pressure to be released at the end of the year, as well as a manuscript on the integration of ACT and EMDR. Welcome, Dr. Travia.
Thank you so much.
All right. So, even before we get into the topic of forgiveness, I wanted to ask you to tell people what's the difference between a psychologist and psychiatrist because they're
Yes.
confused so much.
Psychologists have PhDs or PsyDs in clinical psychology. So we're licensed to practice clinical psychology as clinical psychologists. And that's the PhD level. So people refer to us as doctor because we have the doctorate and it's a clinical training program. For psychiatrists, they are medical doctors who provide medicine and can treat in those kind of medical realms.
I have people call me psychologist all the time, and I have to clarify, hey, I do medication management. And it's interesting how people don't understand the difference. And it's important to know because there are certain things that I absolutely cannot do what you can do, right?
Yeah,
As a
different
psychologist.
focus and also things that only like say compared to an LCSW, for example, a psychologist can do psychological testing and most LCSWs can't. So there's differences in the degrees and what we focus on.
All right. So, forgiveness is such an interesting topic. And, most people, I think I read it somewhere recently. I don't know if it was when you and I were talking or somebody was like, so if you don't forgive, how are you going to move on from trauma? So this is going to be a great topic to talk about and educate people on because, it's important to know what is actually happening and how mentally it affects the victims when they're being pressured into doing that.
Sure. Yeah, and I really come from a trauma background, so so much of what I've seen is because I've seen so many patients who've been victims of such wide-ranging trauma, but not even like the big T trauma. We distinguish from big T trauma, which is the acute trauma, like a sexual assault or seeing war, things like that that are one shot, really terrible, horrible. Anybody would agree this is terrible. Little T
Yeah.
trauma, those kind of daily bullying, neglect by parents, where there's no obvious abuse, but over time really wears away at someone. And that also people very often will push people to forgive. And that idea of what forgiveness is becomes very complicated.
Absolutely. All right. So I am going to ask you, so what is exactly forgiveness pressure? How would you define it?
So first I'd want to define forgiveness, right? And a lot of people, when you ask them, what is forgiveness? Right? Like, what
Hmm.
does that even mean? And you get all these different answers. It's an action. You forgive. You take this action of forgiveness. But if I ask you to show me what that looks like, you probably couldn't.
Yeah.
It's a feeling, right? I feel forgiveness, but it's not one of the basic emotions. It doesn't come with us when we're born, right? Anger, sadness, joy, those are pretty basic, but so it's
Hmm.
not that. It's a sign of a good person. So bad people can't forgive. That doesn't seem like that's a very good definition. So as we look through like what really is forgiveness, I look to see what's natural. And what naturally happens if you've ever been hurt by someone, like a really good friend, if you think of like someone who's really close to you, they've hurt you,
Hmm.
right? We can't get away with life without being hurt by people we love, because we all make mistakes.
Absolutely. Yep.
What happened that let you let it go? Because that's often what people say. Forgiveness is letting go.
Hmm.
They made it right. They did something that showed that the person that you knew, this good person, they made a mistake and they did things to go, really sorry, that was awful. I won't do it again. And then they didn't, or they tried really hard not to. So, in my view, what forgiveness really is the natural consequence of trust being rebuilt in a relationship. It's
That's a
really,
really great way to define it.
yeah. Yeah, because when someone hurts us, I actually like to say that we don't ever really build trust until someone breaks it. Because then we give them the opportunity and we test them. We give people enough rope to hang themselves or to climb up the mountain with us. And when they climb with us, we build this beautiful, deep relationship, because that's really, relationships are built on the hard times. So yeah, I think it's really a rebuilding of trust. And what that means is forgiveness is built because someone else did their work.
Right, right, right. Absolutely. That makes so much sense. Like, I never looked at it from that angle. Thank you
Yeah,
for explaining it
absolutely.
that way.
Yeah, I think it's a exciting idea, because a lot of people really get caught up, and especially trauma victims, because they do experience this forgiveness pressure. And forgiveness pressure is when other people are telling them, let it go, stop your natural feelings of anger and resentment. You shouldn't feel those things. Whenever we tell someone you shouldn't feel something, that's never right. Feelings are valid. They're just signals. So pressure is when people are telling you, stop being so dramatic, stop being so much, stop being so upset, stop being so hurt, when the other person has done nothing to change. And often they're very focused on you as the victim and not the person who hurt you. Oh, you
Yeah,
know how they
yeah.
are. They can't change. It was so long ago. And that's where the pressure comes in. And because as a culture, we've internalized this view of good people forgive, I now have to do this thing that's absolutely impossible to do.
Mhm. So just going back to the anger and resentment, right? So if like somebody doesn't forgive they're holding on to this anger and resentment, isn't that like more harmful? Like how like that's why we tell people, right? Let it go. So it's
Yeah,
like,
anger and resentment are poisons, and you're drinking the poison to hurt somebody else, but you're only hurting yourself. Yeah, right, all these things. What I have found is that anger and resentment, and especially anger, is a very primal emotion. It's built into us. Forgiveness is not. Letting go is not. Our brains are built to look for the negative stuff. We remember it more easily. We focus on it. It's more salient because it keeps us safe. And if we don't acknowledge those feelings, and this is that ACT perspective, we have to acknowledge our emotions and accept them. Like, hey, I'm angry. Why? Why am I so angry? Usually we are not angry if someone has made it right. Like, if someone hurt us and has done everything they can to do right by us, and truly not like just words, we're not still angry. If we're still angry, there's a reason. And so for me, that anger and resentment becomes a really clear signal that something's not okay. And then, especially with someone who's been victimized, really trying to understand what happened. Why are you so angry still at this person? And you'll often hear stories, right? Like, my parents are so upset with me. They just wish I could just let it go. And then you hear the
hmm
story about how a sibling sexually molested them for years when they were children. And the parents were like, well, that's stopped now, so it's okay. Why can't you just sit at Thanksgiving dinner with your brother? Well, I don't know why not. And they're just kind of,
Yeah.
right, this kind of, let's just forget it. But nothing has been done to heal the victim. They've been told it wasn't a big deal. Why are you so upset? We made it stop. Like, but no real interventions happen. No one's really taking it seriously. They're angry because they haven't healed. They haven't been able to accept that they're angry at their parents. They might really love their parents. They might be good people. They just have this blind spot, but they need to heal those parts before the anger will go away.
Yeah, yeah.
And that's, of course, very complicated therapy, whether we're doing EMDR, whether that person is working with their parents in family therapy, what's
hmm
happening. But instead, they're stuck in, I have to just let it go. Why can't I get over this? It was 20 years ago.
Yeah, yeah.
That's where the anger and resentment's coming up. It's a signal that they have to heal that.
Yeah. I have so I personally I really like anger. Like that's like my favorite emotion because I'm just like if you're not feeling angry, like why aren't you feeling angry? If you're saying you're not angry, that's not okay, right? You
Yeah.
should be
Yeah, there's
angry
so many
in
things.
situations like this.
It's very
Right.
motivating, and we don't wanna stay there all the time, and that's the fear, I think, so many people, right? Like, if I could just get rid of my anger, I could feel good all the time. That's not true. We can feel good and feel anger. we can feel, and that's a very third wave psychology act perspective, right? We have room for all the emotions, right? Like I'm
Yes.
like, I love wakes as an Italian, like big wakes. You got 100 people, all your cousins you haven't seen in years. It's sad, right? You're grieving the dead, but also there's all these people showing up to talk about how much they love this person, how much they love you. There's beauty in the sadness. There's joy in the grief. If we could expand more, and that's where I think these feelings like anger and resentment, we could hold those. You could be really angry at parents who didn't protect you. You could be angry at friends who betrayed you and still love them as the human beings they are for all the good things they did. And that's, I think, so important. For me, that's really more important than the kind of flippant use of forgiveness. It's how do we rebuild trust? How do we heal these relationships if possible, or heal ourselves and keep ourselves safe by not forcing ourselves to repress emotions that are really there for a reason.
Yeah, absolutely. So going on to kind of like the damage of, being forced to forgive, can you elaborate a little bit more on, if someone is forced to forgive your brother, for instance, that was a great example. So can you elaborate a little bit more on like what the damage would be, mentally and just overall quality of life of a person that's being forced to forgive something like, incest?
Yeah. So I think there's a couple of places where it happens, right? If it's we're repressing emotions, that's going to cause pain. It's also going to cause outbursts. And then this is where people are like, oh, you're so dramatic. You're always so angry. It's because they're holding it back and then something triggers them and they lose that. So there's this almost gaslighting that occurs where someone is
Uh-huh.
forced to really fight their own emotions, their own body, because emotions are in our body. They're the things our body, it's how our body tells us something's going on.
Yeah.
You see people putting themselves back in dangerous situations over and over and over again. Either they're having to sit with the person who victimized them, or a friend group even who's like, oh, Brian's always like that. He just makes fun of people. Well, he tends to bully one person. You should just get over it. And so you're constantly in the situation where you're being bullied and hurt and made fun of. And over time, we know how harmful bullying is, especially when
Yeah.
your entire friend group's going, oh man, I don't know why you're so upset. You know how he is. We put ourselves back in these dangerous situations. If that thing wasn't that bad, well, then why would I avoid it? And then you're constantly in conflict. I think it really keeps people from doing the work of rebuilding trust. It refocuses on the victim instead of the offender. So, and I'm using the term offender very broadly because it really can be very minimal things or these big T traumas. But instead of focusing on, well, why don't we all tell Brian to stop being such a jerk? Like, why
Mhm.
don't we talk to Brian and say, like, we don't like your behavior? We focus on the person who's getting hurt. The focus is in the wrong place, and it doesn't give people the opportunity to grow. So maybe Brian would be like, I didn't realize it was hurting people's feelings. I'm really sorry. I thought he thought it was a joke and he was cool with it too. No, everyone's afraid to contradict you because you kind of get crazy, right? Like then we can have a conversation. Now, Brian may or may not be ready to change, but we don't even give him the chance. So we
Yeah.
really
Yeah.
restrict growth when we tell people to just get over it, which is also impossible. We cannot get rid
Yes.
of
Yeah.
emotions. We can't get rid of songs in our head. How are we going to
Yeah.
get rid of feelings? They're there for a reason. Yeah.
Yep, absolutely. Okay, so I guess in that kind of context, like for instance, we're talking about Brian, right? So how would that person like one, how do you as a professional, I guess help your patient or your client confront or express their feelings to this person, or do you bring them in and like talk to this person? How do you approach it? Because I mean, I would love to know too how you're handling this for my own patients. Yeah.
Yeah, I mean, in traditional trauma therapy, and especially something like EMDR, individual therapy, right? I'm seeing the client. And Brian isn't my problem in some way,
Yeah.
right? Or mom
Yeah.
or dad is usually the bigger issue.
Yeah. Yep. Yep.
The first place we're going to go is how do we get you stable, healthy, whole, and healed enough that you can start setting limits with your parents, right? The word no is one of the shortest words in the English language and the most difficult to pronounce. Like people can't say it. And with parents especially, these are long-standing habits, long-standing behaviors, right? So
Absolutely.
when people begin to heal their own injuries, they can accept their emotions. They're not
Mhm.
in this push and pull. They're not feeling constantly triggered because they're letting it out enough. They're not fighting themselves. Then they start having a little more ability to say no. a little more
Mhm.
capacity to set small boundaries. And in ACT, so I integrate those two methodologies. ACT is very much about you do the tiniest possible succeedable behavior. I want to make
Mhm.
sure that when we talk about, like, I want you to try to say this to your parents. You've identified this as an issue. How likely is it you can say no to Christmas? Zero. There's no likelihood. We're not going to Christmas, right? How about no to Sunday dinner?
Mhm.
Okay,
Mhm.
that's hard. How about you go to Sunday dinner, but you come 30 minutes late? Like, where's the wiggle room? Where can we do something that feels I could accomplish that?
Mhm.
Or how can you tell mom, I want to come see you, but I'm not going to come when my brother's there. Where's the lot? Where's the, okay, that I think I can do. What can we do to make that more possible? So we start installing these little small limits. And when it's a success, there's a what we call reparative experience. They can start internalizing, like, oh God, I said no. And my parents, I'm still having dinner with my parents. Oh, wow. When those little successes happen, we begin to build on those. Now,
Mhm.
for some people, it's too dangerous. If the situation's so unhealthy, so dangerous, the person just cannot be in the room with these people, then we start building boundaries of, like, okay, you don't go to any dinner. You don't go to Christmas. You don't go to dinner. And we're going to explain, we're going to tell your family why, and we're going to talk about how we're going to do that if they want to rebuild the relationship. And most people do. Most people do not want to go no contact. That is a really limited set of people. When people do, I absolutely respect and support it, knowing that it doesn't even have to be forever. But for most people, they want to rebuild those relationships, and the people in their lives want them to,
Mhm.
right? So mom and dad love both, but they're going to focus on the trouble kid, right?
Mhm.
Because they need help,
Yeah.
not understanding that the not trouble kid really also needs help. They just never did it. So as we set boundaries, those parents, because they want the relationship, will begin to fall in line. Like 99% of the time, I have seen amazing transformations in families by just working with my patient and having them set limits. Totally changed the dynamic of the family. That's not always true, but it's true a lot.
Yeah, yeah, absolutely. I can think of a couple of patients that I've had them keep their anger and do that. I absolutely agree with you. So, I'm gonna ask, like, I'm gonna go off a little bit on a tangent. So this is like with families, right? What if, the person that wronged you was either a stranger or an ex-partner or something like that, and they're not in your life now, right? So the healing that comes with that, because then you're like, oh, let it go, right? And especially in that scenario, because this person is not even in your life anymore. So how do you help patients do that?
Yeah, so, we sometimes we have to wake the dead, I like to say, and EMDR is so beautiful because when we process with it, it's imaginal in a lot of ways. And so we're not recreating necessarily different scenarios, but you can give the brain an option for what is let's look at if this had happened that way. If you could
Hmm.
wake the dead, what would you say? Let's play that out. So sometimes that knowing full well that's not happening in reality, and EMDR isn't like hypnosis where you install a fake
Yeah,
memory. It's not like that at all.
yeah.
But it does let the person kind of say the things they needed to say. And therapists very often what our job is we're just holding safe space and we're a witness. I'm just acting as a witness to this process.
Yeah.
And even when it's just happening in someone's mind, they know they're being seen. That can be incredibly healing. And sometimes it's tell that person all the angry stuff you couldn't do while they were alive. You can say the most awful things and I'm here for it. You could say whatever you want in my office because they know that I'm safe and I'm not going to judge. And they've felt judged even in their own mind. So holding that space becomes important. Sometimes if it's a stranger, if it's like a bad actor, someone's in prison, they can write a
Hmm.
letter that they often never send and often shouldn't. Like, we don't want to give an offender any bit of them, right? But again, we're witnessing, we're holding that. I could put that in
Hmm.
my filing cabinet and contain
Hmm.
it. And now it's real. Sometimes it's really acknowledging the love and the anger at the same time and really
Hmm.
holding those. And sometimes we'll do some methodologies around holding both and expanding. They don't have to be there. They don't have to rebuild trust for us to heal. That's the nice thing is that healing is intrapersonal. It happens internally. It helps when it's interpersonal. That's nice, but it's not necessary. And if you need the other person, the therapist can often facilitate being the witness to that process. But the person's really healing themselves. It's they're
Yeah.
often their parts, their child parts going, you're an adult and you're not scared anymore. You can protect us now. Oh, we're not scared. It's like the child part has to know that our adult self is an adult now and they're not the little kid running around being scared. Yeah, it's there's a lot of ways to do that. I've seen deathbed work, like people doing work with parents on their deathbed and being like, by the way, I'm really angry.
Mm-hmm.
Often the parents were like, "I am so glad you finally brought this up," or "Thank you for this opportunity to let me earn forgiveness," right? Like it's this beautiful moment where someone's like willing to let down all their guard. So even then, sometimes I've seen people do that, do really intense work as a parent was going through like chemo or something like that.
Cool. Okay, so how does the person that, needs to rebuild trust, not your
Yeah.
client, right? Not your patient, but the other person, how do they go about doing that? How do they go about earning that forgiveness?
Yeah. And I talk about this a lot in the book about kind of how to do this. And the first thing, of course, is acknowledging the harm. I think we always have to start with, I hurt you somehow.
Hmm.
And especially when someone really didn't mean it, right? Like, oh, I said this thing and that's not how I meant it. But they have to acknowledge, yeah, and I could see how that really hurt your feelings. Gosh, I am so sorry. So they need to make the apology. That is important. We need to say the words like, gosh, I'm really sorry. That came out terribly, or gosh, yeah, I know that I really screwed up there. And then they need to, and I'm gonna read off my notes here so I got them right. They need to recognize how and why it caused harm.
Hmm.
The remorse is the apology, right? Really saying like, I'm not only saying I'm sorry, but I mean that. Like, I feel bad that this hurt you. And then they make an amends. And amends can be as simple as I'm going to tell so and so that I really screwed up, right? Like
Yeah.
something to say, like, oh, I said something in public. I'm going to apologize publicly. I'm going to say, like, hey, I was drinking too much the other night and I said some stuff to people. Like, what do you need? And it really should be a collaboration because I might say, like, oh gosh, please don't say that publicly. That just makes it worse. But I might say, everyone was there and they heard what you said and it was kind of icky. And if they like, look, I'm gonna post on Facebook. I was drinking too heavily. I know that. And I'm gonna great, yeah, make an apology. Thank you. Whatever that is, it has to be offered and taken. And so sometimes we need to ask for that. We need to say, look, this is what I need you to do to make things right. But as the person who's asking for forgiveness, it's often, what do you need me to do? Like, what do you want? Let me give you some options. And a good apology should involve like, ooh,
Yeah.
I screwed up. Let me figure out what to do. And then
Yeah.
it doesn't happen again. And some behavior is so habitual that it's going to start happening again. And you have to be like, "It's me." And hopefully the other person recognizes, like, God, I'm doing that thing. Some things are
Hmm.
so egregious, prison time is the amends. And you're never in my space again to rebuild trust. Like, we're not going to be friends. We're not going to rebuild trust between us. There is no trust to be rebuilt. So again, it depends on how extreme. But most wrongs, if I have a particular, I'm from New York and I like my personal space. And I don't like touch talkers. If you've ever had somebody
Yeah.
who they put their hand and they keep touching you and they're talking, right?
Hmm.
If you're trying to get my attention, talk to me. So I will tell people like, "Oh, you're a touch talker." Most people will be like, "Oh, oh, they don't even know they're doing it."
Yeah.
Like,
Yeah.
cultural, what have you, they just don't even know. They're like,
Yeah.
oh god," like, they're really upset about it, like, "I'm really sorry,"
Yeah.
but they will do it again because it's such a habit, but most decent people will be like, I can't I didn't even know I was doing this, I'm so sorry," right? And then it is up to us to be willing to give people the benefit of the doubt, to be willing to accept that changing habits are hard and people don't always get it right, and to be willing to be gentle with this as well, especially if it's these small little picadillos or it's like, I mean, they're not trying to hurt you. Versus I've had people go, oh, am I the creepy guy? Yes, now you're the creepy guy. Now you are. Like, you just made that because that person is not apologizing. They're not making an amends. And even in something small like that, if you're not willing to accept that I'm setting a limit, now I know I can't trust you. Now my limit's even further.
Yep.
And that, I think that's one of the pieces of what I've done in talking about this topic is really about boundary setting. Like, you've got to say no because otherwise they're going to keep poking at you because you didn't tell them not to. Yeah.
Yeah, absolutely. Okay, so I want to talk about the people that like put pressure
Mm.
on forgiveness, right? Because that's um not just like your parents per se,
Right.
right?
Sure.
There's a lot of people that will pressure. So who are they and how do you, if I was the client, how would I deal with those people to stop telling me to forget.
Yes, and I think that's a beautiful way to, like, stop telling me that, like, that's not gonna happen.
Yeah.
I think it's helpful when people are educated on what this is to say, look, my anger and my resentment makes sense. I'm still hurting when so and so makes it right. This is what I need. And it's having the confidence and feeling supported enough to tell people you can't say that. But yeah, it's often parents, it's your church, your community, your mosque, whatever it is, right? Someone in your religious community, the phrase, uh, oh, um, to I'm gonna think about it in a minute, but to err is human, to forgive is divine, right? So this idea, and very often people think that means we have this mandate to forgive. That's not actually what the original phrase was meant. It's in a longer essay. And the point of it is forgiveness is divine. God forgives. And it's hard, even in the literature, for God to forgive. Sometimes God gets real angry, depending on which tradition you're from. Forgiveness is a godlike thing. So we could strive to be kind, which is really what it means, but it's really hard. So when we can educate other people about our own emotions, why they're there, people often, that's a lot easier than I just can't get over it, right? So
Yeah.
helping, like, I've seen this at work where people are having a very difficult work environment, a toxic work environment, and there's somebody who's particularly onerous at work, and everyone's like, you know who she is. It's my least favorite phrase in the whole world.
God, yes.
You know how she is. She's just like that. Like, she's like that to me. Why is she just like that to me? So often it's like, no, you can be angry, but what do you want to do with that? You want to keep documentation? Like, where do you want to put your anger? Maybe at work, constantly complaining is not the right place. Maybe you do need to leave the work environment. Maybe you just have different limits. That's work for internally. Friends, we need to help friends see, like, look, Brian's a jerk and I'm angry and I'm not happy hanging out when he's doing this. So either you guys support me or I am going to have to leave the group, or I'm only coming when when we're like going to the movies or something. We're going to have to deal with
Hmm.
them. I've had clients who have like the one friend who unfortunately drinks way too much and gets mean and nasty. And they're like, I don't, people start drinking, I leave. I don't want to hang out with this person when they're like that because they're just nasty to everybody and it's uncomfortable. So we need to tell people, but anyone can engage in forgiveness pressure. A lot of people do. Random people on the street, like, we'll be like, oh, you'll be chatting with some new stranger and they're like, oh, you should forgive your mother. What the hell? People do this all the time. They'll hear a story and tell you what you should do with your emotions. And we do need to be like, I'm working on that with my therapist. Thank you very much. We need to stop that. But I think the person who most likely is to engage in it is yourself. That
Yeah.
internalized sense of, if I was good, if I was smart, I hear that all the time. Like, what's wrong with me? Like, why am I so lazy, stupid, broken that I can't just forgive? It's like, oh gosh, there's nothing wrong with you. Your physical experience is telling you something isn't right. And so I think
Right.
it
Yeah.
starts with us. It starts with the internalized forgiveness, and then we could
Yeah.
deal with mom and dad and cousin Becky.
It's so funny when you said your words were, they'll say that that person does, you know how they are. This actually happened to me in my personal life, right? One, I hate it when mental health providers are expected to continue their work when they're not working.
Right. All the time.
And my answer to that was, well, yeah, sure, you're telling me that this person's personality is like that, but maybe they should go fix their personality.
Why do I have to change?
Exactly. Or why do I have to tolerate it?
Absolutely. Yeah, we shouldn't tolerate anything, I think. There's people for whom, like, your uncle who now has dementia who says things that are really inappropriate. It's like, he's not well, right? Like, he's
Yeah. Yeah.
genuinely sick. But that idea, still, you could be like, no, we don't say things like that. Like, it's not okay. I had a boss once who I was on like a practicum and he had had a stroke. He came back and he had been bad to begin with. Old guy from like an older time where he would make inappropriate comments to all the women staff.
Mhm.
It wasn't at anyone, it was everyone. It was inappropriate. And he got back and it was 10 times worse after the stroke. There were no gates left. And I mean, some of the things we used to joke that we were going to sue him for sexual harassment and split the money with him because we felt bad for him, right? Because you do, because
Yeah.
he's just like this old guy. He said something to me at one point and I was like, I was a student, so I had no tell at all. And I walked up to him and was like, I don't care that you had a stroke. What you said was inappropriate and you will not talk to me that way.
Yeah. Yeah.
And
Yeah.
he cried, this poor little man, right? But he apologized and he was like, you are absolutely right. That wasn't
Yeah.
okay. And he recognized it, but no one had ever said to him no. I
Yeah.
think, like,
Exactly.
someone, if you don't ever tell someone,
Mm-hmm.
You're not even giving them the chance again to grow and be a better person. And he really did. He started really watching what he was saying, but no one had ever called him to task.
Yeah.
But
Yeah. This is why I love anger, because my anger will be like,
yes,
no.
yes, I will get very Sicilian, and I will, I've done that in I worked in prisons when I first started. I was a forensics. I worked in forensics. I did sexually violent predator work, and these guys were twice, four times my size, and like dangerous criminals. And I would like look up at them and point and tell them like you talk to me respectfully, and they would put their heads down and back up and be like, you show this woman respect, and they would because they respected strength, and sometimes that's all it takes. Not all the time. And there are people who will not respect it. And that's a different topic. But yeah.
Yep, absolutely. Okay, so now that I said that I like anger, let's talk about
Yeah.
is anger, well, resentment, I kind of like to separate the two,
Yes.
but like anger and resentment can for some particular person, can they be actually harmful holding on to all of that?
Sure. Yeah. And so what I tend to find is that there's a few places where anger and resentment are, and it's good to probably separate those. Anger is that really natural, just like I'm lit up kind of. Resentment is I'm holding on to resentment is almost the cognitive aspect of that in this context of forgiveness. It's that person did something and I'm still angry about it. It's unhealthy when the person has done everything they can to make it right and they're a decent person and you care about them and for some reason you can't let it go. So there's been like one incident and 20 incidents of good behavior, but you're still like, but they did this thing.
Mm-hmm.
There, I would stop and really explore why is it sticky? Is it you don't trust the person that even though they haven't done it again, there's something about, and usually if someone's gut is telling them something isn't right, something isn't right.
Yeah, yeah.
And there's something there. So it's an exploration. For some people, their anger and resentment has kept them safe. They're fine with anger and resentment, but they've let it be towards everyone. So they don't trust anyone, even if they have decent people and they're like, I don't trust everybody. Everybody says I have trust issues. If someone makes one tiny mistake, they're gone. I don't even give them a chance to apologize. Now that's unhealthy. It's overgeneralized. And we want to work on that because most people are decent and most people will fix their behavior. If it's just kind of taking over, like you can't think of anyone else, it becomes kind of obsessive or compulsive and there's no freedom from it. It just feels like all I do is sit in my anger. And that's a trauma response. Usually that is, I am so injured by what happened that I can't let it go. No, you can't. You need to heal. And really, then the refocus becomes how do we heal the traumatic past? How do we heal the wounds without letting go of your anger? So we don't have to give up anger, but if you don't
Yeah,
want it flooding us. So it
yeah.
becomes like because a lot of people, I think the myth that people believe is if I let go of the anger, which we can't let go of anger, but if I kind of heal, I will forget what happened and I'll let it happen again. That's not true. Trauma therapy is not about forgetting the past. It's about the way I describe it is we're taking trauma reactivity is like there's a book on your shelf of this horrible memory. It flies
Mm-hmm.
off the shelf and hits you in the head and opens to the most worst picture you possibly can think of at random times. That's
Mm-hmm.
PTSD, right? Like that's flashbacks. That's
Very good. Yeah,
right.
very great
And
description.
so EMDR, what it does is it allows us to take the memory and move it into the place of memory, not reactivity, so that I know the books on the shelf. It's part of a whole series of books of my life, but it's just one book. It's not the only book now. And I can take it down and flip through it and I decide what pages I look at. That's a normal kind of unreactive memory. That's a processed memory. And that's what we do in EMDR is we're helping that memory move so that we could see the whole shelf now. Oh gosh, there's a ton of books. I have a whole life. It's not just this one thing. It doesn't define me. And so when all we can see on the shelf is the trauma, yeah, it's going to fly off the shelf, but now it's just a part. So that's the work. And that's where anger becomes much more manageable. And again, I could still take the book off the shelf. You'll not lose your instincts. As a matter of fact, they'll be clear because you're not so overwhelmed. When my hackles go up, if I feel a little, my gut goes, something ain't right, something ain't right. Like I know that I trust my inner experience so much that someone does, I can't even tell you why in the moment. I don't know. Just, I don't like them. I don't know. And 100% of the time now as an adult, I am always right. Like there is something I'll find out later. They're like, oh, that person. And I'm like, no, that's what it was. I might not know what's
Yeah.
triggering me, but I know that something is. And I'll give it some space, but it's important to trust ourselves. And so many people who have trauma, don't trust their gut because people have done these kind of things, like telling them, well, you need to just stop feeling that feeling. So they think all their feelings are wrong. You're actually better at detecting danger when you've healed. And
Right,
that's how we
right.
kind of work with this anger is you can let it go. You can
Yeah.
heal from it and you're still going to remember not to walk down a dark alley at night. You're going to remember that when someone starts drinking and they become nasty, you leave, like you're not going to lose your instincts. So that's often why people kind of hold on to it. Yeah. And I think when people just can't trust, they can't be at ease with other people and they feel really stuck. That's where the anger and resentment is just signaling they need to heal. So the anger and resentment isn't bad in and of itself. It's uncomfortable and we need to do some work to work that through.
Yeah.
Hello, this podcast is being sponsored by FMP Mental Health Spa and Family Psychiatry. If you need help, please reach out to us via our website or email or call us. We are available in Tampa, Florida in person, as well as via telepsychiatry in the states of Florida, Georgia, Kentucky, Virginia, and now Pennsylvania as well.
Okay, I'm thinking about like a scenario with myself because that's the best way to do it, right? Where I was angry at this one person that everyone is saying, "Oh, you know them," right? And so and while everyone was telling me to just let it go or forgive, I just absolutely my anger got more and more rather than
Sure.
it decreased. And it took months before I got to the point where I was like, okay, now this anger is just exhausting me. And I'm kind of ready to like let it simmer down. Not that I'm forgetting or forgiving or whatever, but I'm just gonna let myself like just kind of calm down and come to a place where I can manage talking to this person, but at the same time keep my arm's length where I am
Right.
comfortable.
Yeah, and I love that, right? Like you did your own kind of healing and said, where do I need to sit with this? What are the boundaries I need to set? How do I want to get comfortable? I often tell people to cultivate apathy. Like they're fine. They're just they're broken, they're injured, they're sad. We can't always do that. But I think, when we can, it's a strength. And some people say, well, why can't you just do that? Well, we can't just do that. That's the problem is we can't make ourselves get there. We have to get to a place where we figure out where to put the toxicity if
Yeah,
we're going to keep it in our lives. But it's interesting
exactly.
how that pressure serves everyone else because no one else wants to be the target. That's often the reason. No one wants to tell that person change. But if everyone got together as a community and said, you're the bad person, stop that, don't do this thing anymore, they probably would.
Yeah, yeah,
And it would help you. So that would be like, I would say, like, why not tell people, well, why don't you tell them to stop their behavior? Why are you telling me to stop my behavior? But that's
yeah.
harder. It's way harder because you're nice.
It's harder, and, like, I feel like, in my case, I think that other people and I probably was the only one that had said something, and that's why
Yeah.
things were put towards me, but it was just, "Okay, if you guys can't handle telling this person, then, I don't wanna do anything with it right now, and I need my space because I'm angry." Like, I don't wanna deal with this person.
Right, right. And good for you, right, for protecting
Yeah,
yourself. Yeah, and
yeah,
it's hard, but also what I have found is, again, that other people will eventually get on board because 'cause they'll see
yeah.
it because when if you leave that situation, that person will likely focus on someone else,
Yep,
and
yep.
eventually, um yeah, I've seen that, especially in workplaces, I see that a lot when the one person leaves and it's like, "Oh, now there's a new victim," and those people are often like, "Oh my god, now I see it." Because a lot of bullies are good at being secretive about their bullying because they know they're wrong.
Yeah.
They know they're not doing the right thing.
Hello, everyone. I just wanted to stop by and ask you, how are you really doing? Also, how are we doing? Are you guys enjoying this topic? Please leave us comments about it. And also, if you have any pressing questions, please go ahead and leave those in the comments too. We will find an expert to come and speak about it. Finally, please subscribe to the channel, like our videos, share it with your friends, and follow us on Instagram.
Yeah. So anything else like to escape this pressure? I know we talked a little bit about it, but anything else you can advise? Because the pressure is I've experienced all of us has probably at some point experienced it, right? Whether it was for a small thing or a big trauma, right?
Absolutely.
But we've all experienced it. So any other pointers that like can help somebody, escape that pressure?
Yeah, I think, obviously getting good therapy, healing your own trauma wounds, all those things are big. Setting limits, setting boundaries are the biggest piece of especially even the littlest boundary can make such a difference. I will tell people to do a defusion technique where I'll have them write down, make a bingo card of all the stupid stuff a family member might say, and then like just like keep it in your pocket. Every time they say something stupid, you put a little dot on it. And at the end of the bingo, right? And it sounds so silly, right? It's getting that, because if I could predict what someone's going to say, that means it's repetitive, and that means it's not fresh and new. It's not about me. It's their habitual behavior. So if you can step a little further back from it, it gets the thoughts from in here to out here. It's a very act
Mhm.
appropriate, like kind of a technique. It takes it out a little bit, and it gives a little bit of humor to it, which can also help. You can tell people like, these are the 10 things they're going to say tonight. Let me give you a list. And then when they do it and other people are like, oh crap, maybe it is this bad. Sometimes that helps. Expansiveness. Anytime we can get more expansive, it helps, so that if I can focus on other people, places, things, and emotions. So I am annoyed by what this person is saying to me. I am also really loved by the people here. I am also really respected here at work. I had a coworker at one point who was I was the bad object because I was doing what she did, and she had been alone kind of being the star for a long time. She was very open and honest that she resented me, and was, I mean, downright mean in meetings, like really terrible. And at some point I realized, oh wait, but no matter what she says, nobody listens to her. Everyone here respects me. Like, this is okay. And then I wasn't so overwhelmed by it anymore, because usually when people are bullying us, especially, or being cruel, we're fearful of the social group turning on us. So the forgiveness pressure is a way of them turning on us, but we're also afraid that they're going to think we're wrong. They're going to think we're stupid, lazy, whatever the person's saying.
Mhm.
Usually
Mhm.
that's not true, because they're just like that. And everyone knows that, which is why they think we should be able to just let it go. So
Mhm.
part of if you have to stay in the scenario, like you don't want to leave your friend group, you can't leave work, your family, whatever, is realizing that you do have love and affection and compassion within the context of the family. Again, that does not mean that you can let it go, or you just kind of, okay, well, I guess it's okay. It means you could get some separation, you could get some peace in the context of the family or the friends or the group, whatever, so that you can do this work and you can start setting boundaries. Because if you're constantly reactive, it's hard to be heard. So there's some places in there to find some perspective and remember, like, oh wait, my family loves me. This one thing is a problem, but in general, they love me. So how do I get enough peace so that I can have these discussions and start getting some boundaries? So sometimes it's in that vein as well. So that expansive, I'm angry, but I'm also full of love. I'm resentful, but I'm really grateful for, my parents paid for college. They were decent people. They were just terrible about emotions, whatever it is, right? We start moving in the space of feeling more instead of less.
Yeah, absolutely. Okay. So the last one, I'm sure that I've done this where I've hurt people, right? We all end up unintentionally or intentionally at some point hurt people, right? We'll say hurtful things that, we might not realize they're insensitive. So now that other person has to forgive us, and how do you work through that? How do you amend that trust and
Yeah.
earn that forgiveness
Yeah.
without pressuring the other person also?
Right. I mean, it's so important. And the first, I'd say, like, get yourself to a place where you're okay. Like, because sometimes when we hurt someone, it's traumatic. I used to work with offenders, and they were traumatized by their behavior as well. Like, they felt out of control. They were guilty and ashamed, as well they should have been, for a lot of those behaviors. That's not excusing them at all. It's merely we get hurt when we hurt people, which is good. So sometimes it means taking a step back and going, oh gosh, I did this thing, and getting right with yourself. I think the sooner the better. It's never too late, but the sooner the better, saying, I screwed up. And that sometimes is like the next morning you're like, what did I say to that person? Did I? And often I'll like, you do a check, like, hey, can I talk to you for a minute? I said something last night and I'm not sure how it came off, but I think it came off the wrong way. And I want to check with you that you're okay, and let you know how I meant it. Sometimes that's all it takes. Sometimes people are like, oh, no, I totally knew what you meant, because people do give us the benefit of the doubt because we've built social capital. Sometimes we're not that lucky. But the first thing to do is say, hey, I hurt you and I'm sorry. Right?
Mhm.
How do I make this right? And if it's, I was drinking too much, when we're hanging out, I'm gonna limit my alcohol. Or hey, whenever I'm around so and so, I kind of act like an idiot and I don't know why. I'm really gonna work on that. What do you need? Right? I'm gonna ask you, what do you need? Like, can I do something? Like, do you have some ideas? And if it's time, I will give you as much time as you want. Do you want me to check in, or do you want me to like wait for you to come to me? right? Because sometimes people don't even know and they're like, I don't know. Or they'll say, I don't want to talk to you until I've thought about what you said. Okay, thank you so much. We thank people for setting limits. Limit setting is so kind. People forget that, like, when we set boundaries with other people, when we're clear about our boundaries, we're being kind, we're being vulnerable, we're telling people what doesn't hurt us, and it lets you know how you want them to react to you. Like when I tell people I don't like touch talking, they're like, I know, now I know. How many other people have I pissed off? Gosh, I'm so grateful that you were open enough to tell me that. So
Yeah.
we want to affirm the truth of their experience and let them know there may be more work to be done. Like, I know that I maybe for the past year called you the wrong name and I didn't realize it. And oh my God, I feel like an idiot. And you've repeated it 16 times to me and somehow I've still screwed it up. I understand that you're now so mad that you don't want to talk to me. That might take some time. Like, we just have to acknowledge that it takes time when we're asking, this is another important part of setting that too with other people is letting them know how we want to interact and if we do and when. Um, we have to be clear that um, people can challenge us without drama, right? And this is something I think when we're asking people for amends, that we're very clear with them. Like, I don't want you coming back and like checking on me every week. I don't want you doing this. You know, when people are like, so and so still so angry at me, I'm earning forgiveness. Like, no, none of that. That's never going to be okay. You may have to relimit set there. But don't expect perfection from other people either when we're trying to make things right. Some people are in a space where we injure them and they can't recover, even if it's something quote unquote small. And sometimes if we're the kinder person in the room, they'll be angriest at us. One, because they expect more from us. Sometimes because they can. It's not safe for them to be mad at the people who really hurt them. And it's easier to be mad at us. You know, sometimes kindness dictates that we allow for that if we really care about the person. So, you know, there's a lot to be done there. I think time is a big thing. We always want it to be quicker, smoother, easier. It's not. But again, I think the quicker, the better. The sooner we go, oh God, without saying, we always want to say, I didn't mean it that way. And you can, and you should, right? So if I say something and you're like, wow, that was really mean, my instinct is to be like, that's not what I meant at all. But the first thing is to go, oh gosh, I totally can see how that might have come out that way. I'm so sorry. I wasn't careful with my words. What I meant was blah, blah, blah. But if you heard it that way, oh gosh, I should have been clearer because you should have been, right? Because if they're reading it a certain way, clearly it wasn't clear. So it's okay to say, oh gosh, that's not what I meant. But make sure you clarify that, but I screwed up in saying it the way I did, or I said it too quickly, or oh, I wasn't thinking. Let somebody know that you know you're fallible, because that's all most of us just want someone to say, oh, I hurt you. And I'm sorry that what I said, even no matter what it was, I'm sorry that I was the cause of pain for you. Can we now be okay? And you don't repeat it and you try again and you try to fix it and you don't do it with the like, oh wait, I can't say it that way. You'll get upset. Like, don't be an idiot. Don't be mean. These things take time and we need to give people some grace. We all need to give people grace and a little bit of
Yeah. So I'm gonna present this scenario to you because as you were talking, it came to my mind. So this person X that I was actually really angry
yeah.
at, they go back like 20 years and say, I said something to them that was mean. I don't even remember saying this. So now for the rest of our lives, you can be mean or disrespectful or whatever, right? And I've asked for forgiveness. I've said, I don't even remember. I don't know why I would say that. I am sorry. I'm sorry I hurt you. And now I feel at times I see myself saying, can you just let it go? Because now I'm so frustrated because I don't even remember. And I've asked for forgiveness so many times. And you are still in my life. And now you're being like, just vengeful,
Yes.
literally,
Yes.
for something that happened 20 years ago
Yeah.
when I was super immature. So now how do we fix this? Like, I feel bad that I'm saying, okay, can you let it go? But like, I'm in this weird frustration position. So how do
Yes.
you deal with
I'm
that?
so glad you brought that up because I was actually thinking about that too as we were talking about it. So yes, some people don't aren't aren't gracious losers, right? They can't take the apology. They're focusing on you for a reason. Now, their reason is about them at this point. So like some people argue this way where it's like, look, you really hurt my feelings. Well, you hurt my feelings 3 years ago. And the first thing I especially tell couples this, I'm like, people do this all the time. That's where you take the post-it note and you put it on the refrigerator. You go, I'm so glad you're letting me know about that. We should deal with that. Not right now. Right now, we're going to talk about, I'm bringing this to you. I started, so we're going to discuss this, but we're going to write it down, put it on a post-it on the refrigerator. And tomorrow, when this is resolved, we can talk about how I hurt you. Now, let's talk about this because it's a diversion.
Yeah.
When people do this, 20 years ago, you said this. So you've been mad at me for 20 years. I'm sorry you've held on to that. Why did you stay in the relationship with me? I've apologized. I've made things right. Why are you still in relationship with me? Because what you're saying is the thing that I did is defining me for you. You're still mad at me about it. If there's nothing I could do now, why have you maintained this friendship for 20 years then? What's good about me that you've cared to stay in this relationship? And why do you not trust I'm not still 14? Like, what is it about me what have I shown you that says that I haven't changed since then? Like, these are all the ways I've changed. And that might be a way to have that conversation to help that person see, like, you're still viewing me as if. Now, as a trauma psychologist, I would say probably that person has a part of them that has unresolved, that is not grown up, that's still 14 or whatever, and is
Mm-hmm.
reacting to you from that place. And
Mm-hmm.
that part is showing up for whatever reason, when they're threatened, when they're tired, what have you. And it probably has very little to do with you.
Mm-hmm.
But that resolution becomes about helping that person see. Now, you may or may not get anywhere because you can't do therapy with friends, but
Mm-hmm.
that's a way to say, like, why have you been friends with me all this time? I get it. I've apologized. I was 14. Like, what can we do? I can't fix 14-year-old me. Actually, no, wait, I have fixed 14-year-old me. 14-year-old me has grown up into however old I am now me.
Yeah.
There are a lot of things that I don't do that I used to do then. There's a lot of things that I wouldn't say that I would say then. What about our friendship matters to you? And maybe you can go see somebody and talk to them about why this one thing is still so sticky, because it probably has nothing to do with you. It has everything to do with something about the time. But yeah, I mean, otherwise you can't, we shouldn't be punching bags ever.
Yeah.
And
Yeah.
sometimes there are people who, and not necessarily this person in your life, but there's some people who we come into contact with who have their own issues and will gaslight us, will be like, you said this thing and now you need to do these 1,000 things to make it right. We get to set boundaries too, right? Just because we didn't act perfectly does not mean we're bad people. And if you're going to define me, this identity piece, which is one of the reasons I love the concept of identity and I focus on it trainings, is I define myself as a decent person. If I made one mistake and you now are defining me by that one moment in my life, much like trauma, we don't want to define our lives by trauma, then how do we have a relationship? Like, that's not who I am. But you're trying to define me as a bad person. It doesn't match with my identity. That's going to cause me a lot of pain. I may have to disconnect from that person. I said one wrong word and they're angry at me forever. Well, then why would we be friends? That's not a good relationship. So sometimes we do have to
Yeah.
disconnect or set different limits.
Yeah. Thank you. Thank you for that. All right. So I always like to ask, how are you really doing?
Great. I'm tired and overwhelmed, right? I'm finishing up 2 books. I'm doing a lot of trainings. I'm doing a lot of these kind of things. I have a fortunately very rich social life. I'm a part of American Mensa and I have wonderful friends and get to do really cool stuff, but it's a lot. So, always working on trying to balance that out, taking some time for myself, getting some alone time. I live in Florida most of the time now. And so, I get to go to
Yeah,
Disney a lot, which is magical. And
there you
it's kind
go.
of
That's
my
why we scheduled
vacation.
this so early in the afternoon. I gotta go to Disney with my friend.
Right? I mean, it's like being on permanent vacation. So, it's
Yes,
finding the
yes.
balance, but it's pretty good. I'm pretty good. Thank you. How are you? How are you really doing?
I am doing well. I kind of actually recognized a couple of days ago that I feel at peace, and that's like always my goal. And so, even though, I've had like a little bit of tooth problem and pain here and there, and like, that's part of life, but overall, I feel very peaceful and very grateful for, just
Love
everything.
that.
Stress is part of life, but,
Right? Yeah. It's good
so
stuff
life is lifing, as I say. but but I feel
for
very
sure.
peaceful, and
That's
so
wonderful.
thank you for
Yeah, you're
asking.
welcome. Yeah, absolutely. Well, thank you for having me. This has been so delightful. I really appreciate
It really has been. It was so good having you. Thank you
Thank
so much for
you.
taking out the time. And hopefully we'll talk to you at some point again.
Absolutely. I hope so.
Yes. And take care.
Thank you.
Thank
You too.
you.
Take care. Bye-bye. Thanks.
Bye.
Thank you for watching. If you have enjoyed this episode, please subscribe to the podcast and share it with friends. Please connect with us on our social media platforms and tune in next week for our episode on sleep and wellness.